It's music to ears when we hear that yes, the nursing role has been appreciated globally. See, this was not the scenario many years ago. Nurses were not really appreciated to what they were able to contribute. Yes, nurses are able to contribute, and they have a huge plethora of activities in front of them where they can upscale their actions. How do we really want to compare ourselves globally? The nurse is into a decision making activity as well as a role. In India, we have recently introduced the nurse practitioners. This is something which has been in the forefront in the West. The nurses have been into a decision making action oriented activity over a period of years. The nurse practitioner in India today practices in the field of critical care medicine as well as in the field of midwifery, especially in the rural India. Could we have that in more scenarios, and that would allow the nurse to enter into a field where she can practice nursing independently as well as autonomously? Currently, nurse specialization is what's allowing the nurse to enter into the global market very prominently. The field of medical advances is increasing like nobody's business, and is the nurse able to shoulder carry on those advances? The answer is yes, and that's what we are looking forward to, and that's her contribution to globally help the medical scenario in the best possible way. The past 3 years, we are very happy to come to this level and say the past 3 years have ended. When we entered the pandemic, we were not able to really, see the end of the rainbow. It was something which was just never ending. So today on this platform, we are very happy to see that the pandemic has ended. But unfortunately, along with that, what has come is newer challenges. The economy in healthcare is not really what it used to be 3 years ago. However, the consumer who uses the healthcare facility is demanding the same amount of facilities which the individual would obtain before the pandemic struck, and that's the challenge today. Are we really able to meet those demands? The answer is yes, because we have always sort of been extremely positive as nurses to take up a challenge and meet those demands. What is also not really helping is the huge manpower attrition. So movement of the nurses from one institute to another was something which was extremely common. But today that's the challenge which we are not able to meet with very easily. However, I mean, it's much better now than maybe a few months ago, and we have been able to meet those standards in a way in which we can proudly say that we can look for better patient outcomes from our nursing standards. And today on this Nurses Day, we can proudly wish each other a very happy Nurses Day, because that's what it is. Work pressure and this is something which is not only equivalent to me but all my other nursing colleagues as well. Today on this day, we can proudly say that each one of us can say, I'm extremely proud to be a nurse. And how do we go ahead from here? We can just go upwards, because it's like, it's a huge upway rise, because nursing opportunities are getting much better now, and we can definitely do better. And that's what we would want to do in the future.
The global pandemic has shown how vital a nurse role is in healthcare. Now the role of the nurse is expanding. It is determinant of the health, the discipline, the population, the level of care, research, education, leadership. They are involved in advocacy, and very lately they are into policy limitations. They nurture the responsibility of performing assessments, determining the diagnosis, creating health plans, incorporating evidence-based practices, and delivering care. The expanding role of nurses and the self-fulfillment in their profession comes with the expanding role of nurses as nursing professionals and nurse practitioners, which should be the plan for the nurses to grow in Indian scenario. In the last 3 years, there has been a tremendous amount of change in which and by which the nursing profession has been. Clinically, they are more dominant. They are more prominent in terms of the patient efficiencies. They are the patient advocates to look at the healthcare settings. Primarily, they are responsible to be the caregiver, to play the case planner, and they are dominantly in line in terms of the shortage of the clinicians that is in place. Today's nurse has to be foreseen and foreseen to look at a non-paperless working scenario. They should be technology driven. They should understand the versatility of the tools that are used, of the equipment integration along with the technology, and practice evidence-based practices through research and learn from the different practices evolving out of it, and not just rely on the books. If you look at the motivating factors that take me to deal with my work pressure, there's a lot of leadership development which is happening. Every single nurse, being the frontliner, be it a person who is managing a ward, be it a person who is managing a hospital, leadership building is enhanced. Nurses are not just looking at clinically practicing, they are also advancing themselves as business partners. They are growing as operational professionals, and they are also expanding to a great level into quality. As the hospitals and healthcare facilities are looking at accreditations, and quality bodies are more emphasizing on bringing positive change into the environment, and the government regulations and business models run around the different accreditations like JCNAG and NABH, nurses are very importantly playing their role in becoming a vital part and learning these new things which are not being taught too much in their nursing schools. Of course, there is a gap between how the education and the practice is, but with the looking at half of the syllabus, adding on these new trends and norms in the education pattern, it definitely will transform the way nursing is today. It requires to be looking at how futuristic the nursing should be. Indian nursing is healing and finding a dearth because of the immigration, and the nurses are finding, and they find a better opportunity going abroad, looking at the per capita income, the lifestyle, and the other facilities the other countries give. This should also be looked into by the government in order to enhance and bring in a better lifestyle for the nurses in India. This Nurses Day, I would like to give you the message that be always proactive in learning, in upskilling yourselves, in learning the new aspects of industry. Be having a very good networking along with the colleagues. See to it that the different education platforms that are provided through the expert nursing leaders, the different conferences and workshops, the simulation practices which are coming up, be a part of it at all times and always be a learner.
Speaking about expanded role of nurses at a global level, we could broadly look at them under these 4 headings, which is preventive, promotive, curative and rehabilitative aspect. They broadly include things like health education, screening of patients, smoking cessation, identifying illnesses at an early age, lifestyle modifications and so on. Now all these could be carried out at a broader level anywhere, either in a hospital setup, at a community setup, daycare centers, hospice, it could be done anywhere. So these are areas by which we can focus on expanding the role of nurses not just globally but at a local level as well. Last 3 years actually brought out the best in nursing as a profession and in nurses as professionals. There was a lot of visibility which came about during the COVID time. If I have to look back at the last 3 years, I would broadly categorize them into 2 eras, the COVID era and the post-COVID era. But what really hit me during that time is at this tender age of maybe 23 or 24, nurses, young nurses, having to handle the number of patients who are dying, patients who did not have any of their near and dear ones, and we had patients dying in huge numbers. It was physically, mentally, emotionally and psychologically draining for them. In the post-COVID era, the set of challenges that we are facing is different. As we all know, we had lockdown. Nursing students actually attended classes online. And this is a sharp contrast to what nursing is, because nursing is all about having hands-on experience. Attrition is another thing which is killing us today. Gone are the days when overseas nurses were taken with 2 years of experience. Today, overseas agencies are targeting nursing colleges, wherein they want the students to join them at the earliest, that we as nurses enjoy and the type of respect we are able to command at place of work. And last but not the least, when you are growing, when you are nurturing young nurses and these young nurses fly away into leadership position, I think that's a big motivation for me. My message to the young nurses: take the torch of your founder, keep it burning, light other torches, because there's a lot of darkness in the lives of the patient who comes to us. It is illness that draws our patients to us. Take care of them and you will be blessed.
We can expand the role of nurses in addressing global health challenges by ensuring that nurses receive adequate training in global health issues. Nurses should be equipped with the knowledge and skills to address the health needs of diverse population, including those in low and middle income countries. They should also be trained in cross-cultural communication, health promotion, disease prevention, and disaster response. Another way to expand the role of nurses is to promote nursing leadership, giving opportunities to nurses to collaborate with other healthcare professionals, policymakers, and leaders to advocate for global health for all. Since 2020, the COVID-19 pandemic has impacted nurses and the field of nursing profoundly in terms of medical care or treatment that nurses provide directly to the patients, professional activities and responsibilities that nurses undertake in their daily work, and the way in which healthcare system, including hospitals, clinics, and other healthcare facilities operate on day-to-day basis. Nursing is not just a profession, but it is a calling, a passion, a way of life. It takes a lot of courage, strength, and dedication to be a nurse. So, lead by example, walk the extra mile to comfort everyone and enjoy your work. I want to say that future of nursing is bright with all of you leading the way.
Most of the times, nurses are a stark reminder of our nurses' strength, their pivotal role in healthcare. Without nurses and other healthcare professionals, this pandemic battle would have not been possible to win. The work scenario at the hospitals for healthcare professionals has changed significantly since COVID-19 pandemic. There has been a lot of learning challenges for healthcare workers. To start with, I would emphasize on the infection control practices. The pandemic taught and encouraged healthcare workers to ensure adherence to PPE, sanitization, and specialized infection control training to minimize the risk of infection. Post-COVID-19, emotional burnout and awareness on mental health has been significantly increased in healthcare workers. Prime reasons for burnout have been increased workload due to the pandemic. It is essential that hospital management provides adequate resources, support, and training to help employees cope with the demands of their job. On this International Nurses Day, please continue to be the light that guides patients and their families to better health and well-being. As we celebrate this special day, know that your hard work, your sacrifices have not gone in vain. You have played an essential role in shaping the health of our nation, and we are grateful for everything you do.
Of course, the COVID pandemic shown the importance of nurses and other healthcare workers in combating an illness, especially a public health problem. And also it brought limelight on nurses who are the frontline warriors in COVID battle. So, such shall expand their roles in the public healthcare system to ensure promotion of health for all society. Health systems around the world globally were more focused on curative aspects of healthcare, and the pandemic showed the weakness in the public health sector. And though we train our students to be public health nurses, they have enough class on community health. Generally, the public health systems are not utilizing nurses, though there are developed countries where nurse practitioners are there in rural healthcare or peripheral healthcare in large number, like countries like Canada. Or in Indian scenario, it is still limited, though community health officers are allowed and nurses are appointed. The utilization still is limited. So this role has to be further strengthened with infrastructural support and ongoing educational programs to upskill nurses working in the peripheral sector to strengthen the public health systems around the world. And of course, when we look at back in the last 3 years, Nurses were especially stressed during the COVID period because of the shortage of supplies, lack of knowledge how to combat disease, and touch to one's own health and family's health. But we are lucky enough that nurses are trained to cope with such situations during their studies itself, and every day nurses work under stressful conditions. So, in spite of the early setbacks in the time of COVID, nurses have coped well. Not only nurses, all the healthcare workers have coped well. This Nurses Day is very special for all of us, especially nurses, because theme of the Nurses Day is our nurses, our future. It increases our responsibility to achieve or work for achieving the sustainable development goals and a healthier society. And let all of us shall get equipped to deal with present day challenges while preparing for the expected challenges in future.
The life is back to normal again after the COVID pandemic. And the newest challenge we face in our hospitals today is due to the massive exodus of nurses to the Western world. We are grappling with a severe lack of number and competency of nurses in our hospitals, especially the tertiary and quaternary hospitals, as well as in the primary, secondary level too, in all areas, be it urban, rural. So the only way to deal with this is to have more people joining nursing, and of course it is not an overnight production. It will take 4 long years to produce the nurses. And today what we have is very, very young nurses who are either not able to go abroad because of this language issues, because they don't clear their English language test. So we have very young people only left with, and maybe very few middle level seniors. And this is a new challenge of we are not able to replace the nurses with the same competency as they are leaving. And we have no choice but to fast track their learning, their onboarding programs, and with the help of some technologies and involving online learning and having a sense of more hand holding, we are trying to grapple with the situation. But yes, it is alarming. It is more difficult than it used to be even in the COVID times, I feel, because globally there is a lot of demand. Personally speaking, I feel gained more confidence and experience of their contribution to healthcare, and much more we can do with appropriate guidance and support from the whole system. And if I look at the motivating factors, what keeps us going is the sense of accountability on our shoulders, that yes, human lives are what we are handling, and each younger nurse, each one counts when it comes to the delivery of nursing care at the bedside. And at times it is seconds which decide whether someone is going to be alive or not, and or what the quality of life going to be for those patients who are in the hospital. And the sense that the patients are waiting for us, we can't be telling them that we don't have nurses for you. So this is what keeps us going, and it's very challenging every day to be leading a nursing department in any hospital, for that matter, in our country now, and maybe across the world it is the same. And the dealing with work pressure is probably more, for me personally, is involving more in that it's best time to be a nurse in this world, where there is a lot of demand, there's a lot of things that we can do even beyond the conventional frame of what nurses do every day. There is a lot more that we can contribute to the sustainability of hospitals, by understanding what are the nuances of operations. And I look forward to the time that more and more nurses contribute to this overall management of healthcare, and probably that is the way to go forward, because we do have dearth of people who knows and understands and can deal with the issues and problems what we face in our everyday life, in the life of a hospital. And I expect that more and more nurses come forward to take up leadership positions in healthcare in our country.